Well, today I'm delighted to have a fantastic, inspiring guest on the podcast by the name of Aditya Jain. Aditya, I hope that's the correct pronunciation of your name.
Yeah, that was perfect.
Wonderful. Well, Aditya is a medical student at Harvard University, and I came across him inadvertently when doing some research for this podcast and found that he had written an article online, which I was intrigued by because the title of the article is Beyond the Stethoscope, the Growing Appeal of Non-Traditional Medical Careers, which is what we talk about on Life Beyond Clinical Practice. So, of course, I had to reach out to him, I think, on Instagram and invite him to be on this podcast. So, thank you so much for your time. I know you've just out of an examination and you've made time to have this discussion today, Aditya. So, I really appreciate you sharing your insights and looking forward to this conversation. So, you wrote about this growing trend of sort of medical students pursuing non-clinical careers. And I wanted to really pick your insights as someone who's in the medical field, training to be a clinician, what you thought about this trend, and you're seeing it at prestigious universities like Harvard. So before we get into that, perhaps tell us a little bit about yourself, your background, how you found your way to medical school, what intrigued you about the profession of medicine.
Sure, yeah. Well, I'm originally from the West Coast here in the US. I grew up in Oregon, but I went to undergrad at Boston University, where I studied biomedical engineering. And for me, neither of my parents were doctors, and coming into medicine was sort of taking a different path.
Oh,
Uh,
wow.
Yeah, yeah. My dad's
Mm,
an engineer, and so growing up, I had a lot of exposure to technology, I think. And I grew up. I used to love coding, and I was a big science fair nerd in middle school and high school. And I think that's where I started to get some exposure to science and medicine.
mhm.
And I was extremely fortunate that I had excellent mentors at the Oregon Health and Science University back in my
Wonderful.
home state who sort of introduced me to this field of medicine that I wasn't very familiar with. And so I think for me, I came to realize that I was so excited about the science and
Hmm.
sort of aspects of understanding how the human body works. And that carried me to college where I sort of got the opportunity to do volunteering and shadowing and really see what are the lives of doctors like. And I realized
Wonderful.
that, yeah, and I realized that this was sort of a profession where I could take a lot of my love for technology and science and combine it with service and really helping people and
Hmm.
giving back. And so I think that sort of compelled me to pursue medicine, and then I was very fortunate to be accepted here at Harvard Medical School, and where I'm now, in my third year and loving it.
That is awesome because yeah, we all know the proverbial path to Harvard is not easy for many people who have that desire and ambition. So congratulations on getting into Harvard and of course making it this far where you're almost at the end of your journey. But I'm curious, when did you notice this trend of, you know, people you were studying with, or perhaps people who had graduated before you, wanting to move into non-medical paths, and what made you want to delve a little bit deeper into understanding the reasons behind that?
Yeah. Um, I think it was a trend that sort of started to become apparent to me even in my first year of medical school. I think Harvard is it's a very special institution, and I remember
Mm-hmm.
from our matriculation, our dean sort of gave us the speech talking to us about how, people expected us to not only be a physician, but to be a physician and something. And
Mm-hmm.
about, alumni who were physicians and writers, physicians and entrepreneurs, all these different paths. And I think that is when I sort of began to look at, our alumni and see what people were doing. But as I sort of talked to, my seniors and some of my friends at other medical schools, especially, like, for example, like Stanford, where there's this big culture of, looking at medicine and things outside of medicine. That's where I
Right.
really to notice that, there's a lot of people who are kind of pursuing this interesting path. And then as I started to read more about it, I love to write. So I'm a writer for Doximity. And as I was reading more about this trend, I saw this really interesting study that was done, which showed, I think it was 26% or something of students who were interested in pursuing a career where clinical medicine would not be their focus. And that's when I was like,
Hmm.
wow, something that we need to understand better. And so I decided to write about it.
Oh, lovely. That would have been my next question is why did you feel strongly enough to write about it? And by the way, you are an excellent writer. That article is very well well written. So I thoroughly enjoyed reading it and I've read it several times since. Now, in the article, I'm just going to read a bit of an extract. One of the things you quoted was, though every alumnus I spoke to emphasized that their decision to pursue non-clinical paths was deeply personal, I nevertheless was able to identify a few common threads across the range of directions taken. So, just to put it in context for the listeners, I mean, you made the observation, you had heard some of this from your seniors, but you also went out, you took the initiative to actually interview people and find out the reasons behind their decisions to pursue non-clinical paths. And so one of the main themes that emerged from these interviews, from your delving into this topic in more detail, was that medical school grads who had actually pivoted, one of the main things was they were on a quest for purpose and impact, which I find fascinating because this is a key reason why I do this podcast. And I understand that this is a driver for so many people who want to pivot. But I would love for the listeners to hear more about what you uncovered, through these interviews and just in relation to people sharing their pursuit of purpose and impact as being the reason for them wanting to pivot out of clinical practice.
Definitely. I think people who are listening to this, anybody who sort of pursues medicine, uh, they're very high achieving people who,
Totally.
I think and I think people, the things that I sort of mentioned, like service, this desire to help people, to have this impact
Hmm.
on society, is something that drives a lot of us in medicine. So it's really interesting to me to hear from alumni that, after going through the rigors of medical school, some of them even
Right.
going through residency or several years of residency, now we're sort of realizing that they felt they could make a greater impact elsewhere. And, I think we have a joke here at HMS that, often people, they go to undergrad at Harvard, then they go to medical school here, then they go to residency here, and then they become an attending here, and then they live and they die here, right? So
Oh
it's
my
very
goodness.
easy to sort of get into this path of,
Right.
becoming an academic physician. So for these people to, kind of take a step to do something different, they
Wow.
went through a lot of struggles. And I think that passion is really what has to guide you, right? In order
Hmm.
to want to overcome those barriers or challenges, I think that come with changing your profession essentially or changing your
For
focus.
sure. And you want to delve a little bit into that, Aditya, because I know you spoke about it in the article. Like, what were the barriers that they faced when they realized that maybe I need to be doing something outside of, direct patient care? But of course, there's the internal and the external barriers, and just a little bit about your insights into that. Thanks.
Sure. Um, I think a lot of the barriers came from not having that sort of support or really resources. I
Mm.
think that it's a little bit taboo almost in medicine. I think that was one thing I
Yeah.
realized after publishing my article. There were over like 250 comments and hundreds of people discussing it. And one of my advisors told me that one of their colleagues from a different state had like shared the article with them. And so
Wow.
yeah, there was a lot of discussion about it. And I think I was glad it's starting to happen, and we're
Spark the
starting to have.
conversation. Hmm.
Exactly. Because I think that people have that barrier where even if they are unhappy or they're looking for having a different kind of impact, they don't know where to start.
Yeah.
And so for a lot of these alumni, they were very kind in giving me their time and being able to talk with them and sort of understand, and they all brought up how they had reached out to other people too, and their own seniors, to
Mm-hmm.
what sort of options or paths were available to them. But I think just medicine as a whole, I think there's, physician burnout continues to be a huge
Yeah. Big
problem.
concern. Yep.
Yeah, COVID exposed a lot of issues with
Mm-hmm.
our system for physicians and people and medical practitioners in general. And so, all these things I think sort of played a factor in people's decision, but ultimately still
Right.
guided by that desire to make a greater impact, I think.
Yeah, for sure. Now, I come from a health professions education background. I did a postdoc in health professions education. And so I was a lecturer. I've lived through witnessing, allied health workers really um, go down the same path. So we're talking about, medical doctors and specialists now in your world. But in my world, it was, pharmacists and physiotherapists and optometrists who felt pretty much the same. Like, I just don't want to do this. I can't see myself doing this for the rest of my life. I know there's other things out there and perhaps still contribute to your discipline, but just not in direct patient care. But the lack of information about how to do it, what else is out there, and also the shame, the judgment. What will my family think? What will my peers think? You have a decent job. You're so well educated. You get paid a decent salary. Why do you want to now go out off on the beaten track and start something else? And so you have to be brave to chart a new course. So kudos to those who have, done that and then opened up the conversation because I found there's just so many people and they don't speak about it because they don't feel it's safe to speak about it. They feel as if they'll be judged. So I think your article definitely, I mean, I reread it earlier today and I'm like, this is gold because I've observed, encountered, witnessed this through my work, and everything is just on point because you saw it in a prestigious community in the United States. I saw it in Africa and elsewhere with people I work. So definitely in healthcare, there's a trend where not everybody necessarily who trains in a clinical program will have a long-term career in clinical practice, which is why I started the podcast. So what do you, from your vantage point, what do you think are some of the things we can do as universities, as career counselors or coaches or whatever that may be, to help individuals who may even enter medical school but know from the get-go that they're not going to have a long-term stint in direct patient care. They want to use their medical background elsewhere. How can we as training institutions, people supporting students, better support or guide, our professions in training or new graduates on their career path decisions?
Yeah, I think it's a really good and really challenging question. And I think the first thing to sort of get clear is that I think that there's a really big benefit actually for society where we have people who have this medical, whether it's medicine, nursing, pharmacy, anything, having this really deep understanding of medicine, who then pursue something else. I think society
Yeah,
actually
totally.
benefits a lot. And people don't often realize that when we're making these, especially in the US, where we have a lot of, I think, systemic issues, in terms of things like technologies, like new technologies, like artificial intelligence, in terms of like societal issues, race,
Hmm.
bias, all these things, having that medical perspective um, is something that's often missing in the people who are trying to address these problems. So I think that's very important to get clear and for education to sort of make that clear for students so that way there's less of this aspect of, shame, because I don't think that that's really
Oh,
fair. I think,
yeah,
yeah. And so the other thing that schools I think can do is you know, have this sort of uh dialogue with students and connect them
yeah,
to their seniors. I think for me, a lot of it was, I was just contacting people who I knew, people on LinkedIn, and they
yeah,
were, them were just really nice to be able to speak with me. But it wasn't, going through my school. My school didn't have any sort of like, alumni sort of connection in that way,
Mm.
to be able to talk about it and
To
to learn more
leverage.
people's
So you
options.
were proactive really in just reaching out, which is something I also advocate for. You want information, and most people are happy to share their experiences, their insights. And I love what you said about, the fact that a percentage of health professionals choose non-clinical career paths is not necessarily a loss to healthcare, because I think that's the majority's perception, is that if we're losing clinicians, that it's a loss to healthcare. But actually, that insight and experience is so valuable to other aspects that influence healthcare. And that's certainly my position as well. I've actually written a thought leadership abstract, sorry, to present at a conference later this year in Barcelona on exactly that. It's like, what is the role of health educators in reframing what it means to train health professionals? Because we cannot continue with the one size fits all model. And everybody, all 60 students that come into this program are all going to exit, and they're all going to go and treat patients for the rest of their careers. That's just not the reality. So something needs to change. So again, taking that conversation to academic spheres and how we can be more influential in accepting, even as academics, accepting that not everyone we train is going to end up seeing a patient every day, and that does not mean a loss to healthcare. So more of these conversations need to be had. And I'm so glad you sort of lifted the lid off of it with your article. And I was able to interview you on this podcast, Aditya. And just this brief conversation we've had, I know you're going to do phenomenal things in medicine. And you're such an inspiring young leader. Keep it up, just to keep these kinds of conversations going. And I hear your passion for clinical practice. And I love that, because I love, you said it in your article as well. We don't need more, I can't remember the word, like burn, not frustrated healthcare workers,
Yes.
right? Something along those lines. And totally, I've seen it. Professionals who are literally, there's no more heart in what they do. They drag their feet. And that's not what we want when we're
Yeah.
thinking of patient care, when we're thinking of hospital-based care. We want people who are going to come there with passion, despite the challenges, give their best for patients, deliver the best quality healthcare. It's not just a paycheck. It's what you said at the beginning. You're there to serve. And so I'm an advocate for those who love clinical practice. Do that, because that's going to benefit healthcare. Those who don't, please find the thing that's going to work for you, that can indirectly benefit healthcare, so that everybody wins ultimately. So yeah, thank you so much. I think you answered my last question, even before we got to it. But yeah, just maybe forecasting for yourself and your career. Where do you want to take your professional path post medical school?
Yeah, just to mention, I think I would love to read your thought leadership on that also, and it's very very interesting that you bring that up because as I mentioned for this for my role in writing these op-eds, I'm actually my one of my upcoming pieces that's scheduled to be published is on this topic of how we can
Oh, wow.
medical education. And I came to a very similar conclusion that, we need to have multiple paths and, even perhaps a 3-year path where students who are, committed and excited about direct clinical practice every day, students who go undergo that path and then
Mm-hmm.
retain 4-year medical path that gives you a broader understanding of medicine as a whole, that incorporates all these pressing issues like
Mm-hmm.
AI, racism, things like that, environmental justice,
Totally.
and sort of diverging that because I think right now medical education tries to do too much and it ends up becoming unhelpful for the students. So not to go too much into that article, but it's very it was just so awesome to hear that you sort of came to a similar conclusion on that and totally agree
Oh,
with you.
wonderful. Yeah, I'll definitely share it with you and look forward to your article. And I'm sure we'll have more conversations about this, Aditya, given that we our heads are in the same space on this issue. And I look forward to following your journey. All the best as you continue towards the finish line of your medical training. And I know you're going to do great things. So thank you so much for sharing your insights on the podcast episode today. And I'm sure you'll be back at some point in the future.
Thank you. Yeah, thank you so much for having me. And yeah, to answer your last question, I think for myself, I'm still figuring it out a little bit. I've been very
Hmm.
excited about clinical medicine and especially about the field of neurology. So that's maybe in my future. But I've always been someone who is tries to follow that physician and I've been involved with a
Okay.
few sort of startups and advising and things like that. So that entrepreneurship sort of component is always something that's been
Right.
really excited to me too. So yeah, so I'm still figuring it out honestly, but very excited for the future, very optimistic about the future of medicine.
Fantastic.
And thanks again for having me on. It's been really a pleasure.
Oh, wonderful. Thanks so much. Same here. And as I said, look forward to watching your journey.
Thank you.
Take care, Aditya.